Hi, my name is Courtney, and I'm here with Mischa Sogut to talk about Medicaid. Tell me about yourself and explain what you do in terms of Medicaid.
Hi, my name is Mischa Sogut. I'm Legislative Director to the State Assembly Health Committee. The State Assembly has jurisdiction with the State Senate and the Executive over the state's Medicaid budget. Medicaid is a state and federal share program, so some of the money comes from your state taxes, some of the money comes from your federal taxes. And what the Health Committee does is works with the Senate and the Executive to basically build the budget, how much money goes into Medicaid, as well as things like Medicaid eligibility and what services are covered or not covered.
Okay. And how would you say Medicaid in New York State will compare to other states?
It's a more generous benefit. New York has, I think, per capita, the most expensive Medicaid program in the country, which we don't see as a bad thing. Some people see it as a bad thing. But the first trait about it is that it's an expansive benefit, and as a result, it's an expensive program.
Okay. And what changes do you see coming to the program through the Trump administration?
A lot of bad things. The first one is the Medicaid expansion. Medicaid expansion was the additional federal money to cover additional people above the poverty line. And the way that worked is that Washington sent more money to the state than they usually would so that we could cover additional people. If they pull that money, which they haven't done yet, but they very well may, the state basically has a choice. We can either throw several hundred thousand or low millions of numbers of people off Medicaid, leaving them with nothing, or the state will now have to eat the cost entirely without any federal contribution, which means your state taxes will go way up. That was part of the repeal package. That hasn't happened yet, fortunately, because they've tried and failed 3 times to do the repeal. Other than that, in Medicaid specifically, there's also, or not Medicaid, but related, is the exchanges, which were set up under the Affordable Care Act, Obamacare. And the exchanges are kind of for people in the next income window above. So you have Medicaid, then you have Medicaid expansion for people with a little more money than that. Then you have the exchanges for people with a little more money than that. And the exchange is run by New York State, but again, heavily federally funded. And so if they defund those, then again, we have to make a choice. Do we just cut the program and leave people without insurance? Or does the state budget, which can't absorb that kind of a gap, have to absorb that kind of a gap?
Okay. And what groups of people do we see this having the most impact on?
The Medicaid expansion, there's a few different things in the Affordable Care Act. The Medicaid expansion population is people from 100 to 138% of the federal poverty line. So these are people who are not the poorest of the poor, but they're just above it. These are not people who can afford to pay commercial insurance rates out of pocket. So if you get rid of the Medicaid expansion, that's that group. The exchange group is 140% to, I think, 400% of federal poverty. So it's more of what you'd call middle-class people. So if you get rid of that, some of these people around the 400% number probably could afford to buy commercial insurance, but it's spotty and it would eat a lot of their income. The third group that really would be hurt, and it's talked about a little bit, is providers, hospitals, doctors, because when people don't have any insurance and they go to the hospital or they go to the emergency room, because the emergency room has to treat you even if you don't have insurance, which is good because people would be dying in the street.
Yep.
If you go into the emergency room with a stab wound and no insurance, they treat you, but there's no money to pay the doctor and for the supplies and for the drugs and all that. The hospital eats the cost. So when we did the Medicaid expansion, suddenly now the hospital can get a little bit of money from the Medicaid program. So the expansion actually benefits the hospitals because while the Medicaid rates are not really high, they're better than nothing. And so if you pull the expansion, you end up with a lot more of what we call indigent care, which is basically care for people with no insurance, which really screws up the hospital's balance sheets.
Okay. And is there any people that may be affected in a good way?
By repeal?
Yes, by
Trump
Care.
Care?
Yeah.
The companies that run health savings accounts, perhaps, there's this concept of health savings accounts that if you have a high deductible plan, you can pay the deductible by having a health savings account. In reality, most people don't have enough money if they have a high deductible plan to put anything into a health savings account, but that's an idea that Republicans like, and in theory, people would buy health savings accounts. But for the most part, and I say this as a staffer for a liberal Democrat, so keep that in mind, Trump Care is a disaster and will be very dangerous to several million New Yorkers at least.
I agree. And what will New York do to work with these changes if Trump Care does go through?
If they had done a full repeal, which they haven't done, as we know, if they had pulled off a full repeal, you're looking at about $3 to $4 billion state budget shortfall. And for reference, the Medicaid budget's around 21, 22 billion. So state share. So you're talking about almost a 20% funding gap there. And the number of people who would lose their insurance between the expansion and the exchanges is probably around 2 point something million. So the only way you can fix that kind of a gap is you drastically cut spending somewhere else in the healthcare budget, or you say, okay, a couple million New Yorkers don't have insurance. Now, the state courts probably won't let us do that. There's precedent in state court cases for that. So I think what we would end up with is just a huge hole in the state budget. And that's what the governor's afraid of. That's what the Assembly is afraid of. And frankly, the Senate Republicans in New York are also afraid of that.
Yeah, it's scary to think about.
Yeah, we really can't come up with $4 billion easily. So.
Exactly. All right, well, thank you for talking with me today, and thanks for the interview.
Thank you.
Thank you.